Bones are important because they support our body, they protect our organs, they also provide somewhere for our muscles to anchor themselves to, and they provide calcium storage for our body. Osteoporosis, which is weak bone density, is probably one of the biggest problems we see in patients later in life, especially in women. It affects 1 in every 10 females over the age of 60, 1 in every 5 females over the age of 70. And fragility fractures are occurring up to 8 million times annually a year, which is almost an osteoporotic fracture every 3 to 5 seconds in the United States. Bones are important to get us through life, and we need to build our bone bank when we're young. So when we're young, we have the ability to actually make our bones stronger. Most people don't realize, but bones are living tissue and they continually change and remodel. So when we're young, it's very important that we build a strong bone bank, because as we get older, we're going to lose bone mass, and that can be a problem later in life with osteoporosis and fragility fractures. Exercise is important for bone health because, as I said, bone is living tissue. So if we impart stress or exercise to it, it will actually make itself stronger. So weight-bearing exercises as well as any strength exercises are going to help us improve our bone density, our bone mass, especially in our younger years. And then in our older years, it allows us to maintain that bone density. Exercises that are really good for building your bone health or keeping your bones strong are going to be weight-bearing exercises such as walking, jogging, running, tennis, racquetball, soccer, basketball, dance, any sports that impart stress or weight-bearing activity while you're doing them. Strength training is also very important to make our muscles and bones strong. There are lots of exercises that are very good for your overall health, but not quite as good with building bone strength, such as biking or swimming, because neither of those are weight-bearing activities. Exercise should be performed as recommended by the CDC at a minimum of 30 minutes a day, 5 times a week for the average adult. Children from ages 7 to, say, 19 or so years old should probably do 60 minutes of physical activity daily. As we get older, it's still important to continue with your exercise. You may just need to modify the intensity or how vigorous it is. Physical activity is important for all people, whether you're trying to build your bone density or maintain it. What we can't do is regain what's already been lost. So if you are a 20-year-old and you're losing bone density, you cannot remake up what you've already lost. All you can do is hope to maintain what you've got. So it's really important to build your bone bank and then maintain it throughout life.